a modern Western lifestyle, and we'll talk about how that can be pro-inflammatory and obesogenic, is linked extricably to COVID-19 complications. Hence, a physician like me who has spent the whole year researching, writing about, and educating about COVID-19 needs to talk about obesity. And we need to talk about our modern Western lifestyle, particularly with regards to diet, if we want to reduce our risk of COVID-19 complications. The kind of example or analogy I like to put forward is, imagine your body is like a fortress next to an ocean, and you have pirates, or you have invading ships coming in to invade your body. That's the virus. You have about 2 weeks from when the virus gets really close to you to mount your defense. For the first 2 weeks, it's what's called your innate immunity, your frontline basic immunity. After 2 weeks, the reinforcement comes. Reinforcement comes from the capital city, further away. Those reinforcements take about 2 weeks. The frontline defense has to manage that infection, that attack, for the first 2 weeks. However, now what we're realizing is people who go into a hyperinflammatory complication of this disease, often we call it cytokine storm, are those patients who already have ongoing inflammation within their bodies. These will be patients who are obese, diabetic, they have fatty liver, sleep apnea, high blood pressure, prediabetes, etc. So how you can imagine this as an illustration is, if your ocean already has more waves, and those waves are the inflammation that's going on inside your body already before the infection, it's more likely that storm that can get whipped up, that hurricane, that tornado can get whipped up within those 2 weeks, and that storm could take over your fortress before your reinforcements arrive. So what you want to do, if you want to strengthen your fortress, you have to calm the waters, you have to reduce inflammation. And so how to manage obesity and how to manage what now appears to be a pro-inflammatory, obesogenic, Western modern lifestyle is central if you want to reduce the complications of COVID-19. So I'll need a few minutes now to check my stream, make sure we're live on YouTube and Facebook. I would like to also invite anyone on Facebook and YouTube who is listening in. If they would like to type in questions, they're more than welcome to do so. But I will now hand back over to my co-speaker, Seema, who is a holistic nutritionist, and also to my parents, just to get see how they are and get their views on what they would like to get out of today's talk. Handing over, Seema, please go ahead.
Hello, everybody. Yeah, I'm Seema Nair. I'm a registered holistic nutritionist. I graduated from Canadian School of Natural Nutrition. Talk will be more on the strategies of how to get away from obesity. And I think this talk will be such an informative talk because we will be discussing all the things that cause this type of condition.
Well, we are suppose parents. In particular, we do not need anything because we are not obese and we are doing regular exercises.
Yeah.
And we are hill people also, so we go to hills also. So
Yes. Yeah.
hills make people lightweight. One has to be lightweight to go to hills and then do the upward and
Yeah.
downward walking.
Yes.
And
Yes.
so, but yes, of course, being in this company, we, of course, add to our knowledge whatever
Yeah,
we can
that is
get.
the thing, right? Every time you learn something new and then you implement that in your life, right?
Yeah, we implement and we share also.
Yes.
See,
Yes.
now we are senior citizens, and senior citizens, of course, what they do. These days, because of COVID, we are not
Mm-hmm.
sitting together in a company. But Otherwise, all the senior people or retired people, what they do, they collect at one place and
Yes.
talk all these
Yes.
problems, what they are facing. So if we
Yes.
have some knowledge and to give to them, then it's okay. That's good. So even for others also, if it doesn't apply to us, it applies to
Yes.
others. It's good.
Yeah.
Thank you.
Okay. Thank you. Thanks to Dr. Sapan for very useful, informative talk. We are doing exercise yoga every day in the morning, empty stomach, and keeping fit. And as Sapan is giving advice, you are giving advice, so it's very useful. Thank you so much.
Thank you, everyone. So we can carry on with the talk now. So we can carry on. I will start with the talk, and then Seema will do a talk afterwards. So I can request both of you to mute yourselves. Great. Let's start with the talk. So today's topic is obesity management: how to reduce fat and maintain ideal weight. So just getting back to what I initially talked about, that link between COVID-19 and obesity, and the fact that we know that the top two risk factors for COVID-19 complications are hypertension and obesity. And there was a study from the CDC which demonstrated that. Here on the blog we have the classification of obesity. The WHO classification is based upon BMI, and so here it tells you about what is described or classified as overweight, obese, severely obese, and morbidly obese. Of course, if you are very muscular, BMI may not be very accurate in those cases. Also, in South Asian descent, it can also be spuriously low, because unfortunately South Asians like Indians can have particularly low muscle mass. They can have a normal BMI and still have excessive fat buildup. That's mainly because of intra-abdominal fat. Intra-abdominal fat is very important. The fat around your belly. What happens is the fat around your belly, or the fat which is causing your belt size to become bigger, that's an active fat. It's a metabolically active fat. It has more blood supply. It has more mitochondria. When it's expanded, which means there's more of it, and they're larger cells. They release fatty acids into the liver and start leading to conditions like fatty liver, which can also lead to insulin resistance and hyperinsulinemia. So because the cells, your muscle cells and other cells of the body, do not react to the insulin, as a result the amount of insulin the pancreas has to produce goes up, and then we start getting the classical picture of increased triglycerides in the bloodstream and a low HDL as well. Here we talk about the epidemic that obesity is, and it cannot be understated that obesity is a major world epidemic, and it is estimated that after stopping smoking, reducing obesity is probably the biggest, most cost-effective health intervention that any physician can take. Here we talk about the causes of obesity, and there can be many. It can be medical, genetic, behavioral, psychological. We will not be covering causes of obesity, and generally speaking, if a patient goes to a physician with obesity, there would be some standard blood tests, thyroid function, sugar, etc., blood pressure, which would be a standard protocol before you embark upon a journey to try to lose weight. Of course, there are a whole host of conditions which can be associated with obesity. That includes metabolic syndrome, as we discussed before, prediabetes, fatty liver, sleep apnea, diabetes, blood pressure, high cholesterol, heart disease. Of course, pressure from the joints can cause arthritis. Strokes is part of cardiovascular disease. Often obese patients can be depressed, and that can cause more obesity because of comfort eating. They will have fatty liver disease. Women can become infertile. Men can get sexual dysfunction. In pregnancy, there is risk of stillbirth. You can get gallstones, sleep apnea, acid reflux is extremely common, and certain cancers like breast cancer, endometrial cancer, and colon cancer are also more common, as is asthma. Adipocytes, which are fat cells, they secrete multiple pro-inflammatory products, and those include tumor necrosis factor alpha, interleukin 6, MCP1, and there are many gut hormones which also appear to play a significant role in maintaining satiety. Satiety means a feeling that you feel that you've had a good meal. As an example, leptin is very important, as is also pancreatic amylin and ghrelin. These are important. I should point out though, leptin is quite a famous hormone that people talk about. But one thing that we need to also understand is that simply increasing leptin levels does not necessarily improve a situation. At least it didn't in animal studies, because the problem appears to be more a case of leptin resistance. Similar to insulin resistance, the body can become leptin resistance as well. So it doesn't cause satiety like it should. Of course, there are many genetic influences on obesity, and this I find particularly interesting, the thrifty gene hypothesis. And you will be surprised to know that being from the hills in India, I'm a Uttarakhandi. I have gotten to know several friends who are Uttarakhandis, and I have gotten to know, in fact, a very good friend of mine is a diabetes specialist, and I've also gotten to know that a lot of Uttarakhandis actually have high levels of diabetes and obesity. And you would think, well, these are people from the mountains who have been very hardworking, and so why would they be afflicted by diabetes and obesity? Well, this thrifty gene hypothesis could explain that. What the hypothesis says is that our genetic makeup is based upon how we were living our lives for centuries. So we were living a life in the mountains where we did not have very much food. The food was perhaps seasonal. As a result, there was a significant element of feasting and fasting, which meant that you would have a lot of food when there was a crop, and then after that you would be fasting for a period of time. And then the body genetically evolved in such a way that it was able to do that, like a camel in the desert. However, once you move a person with that genetic disposition into the city, where there is no fasting, where there is no lack of food, where the food is plentiful, that genetic conditioning becomes disadvantageous, because all that sugar is being stored, which is then causing prediabetes and diabetes. So that's the thrifty gene hypothesis. So to summarize, a person from the Pahad, a Pahadi person is fine as long as they live in the Pahad. When they come to the city, then they could end up getting more problems, because their genetic makeup is actually designed for the mountains, not for the cities. It goes without saying that obesity increases cardiovascular mortality by 4-fold, also increases cancer by 2-fold. Talking about weight loss now, and this is what everyone is very interested in. So what's a reasonable target or goal for weight loss? Well, something like 0.5 kilogram to 1 kilogram per week is really quite reasonable for a weight loss goal. I would say 0.5 kilogram is good enough. And a lot of my patients, they will be perhaps disappointed that they are losing weight but not fast enough. And I always tell them, if you do it slowly, it's more likely to last. If they do it too quickly with a crash diet of some kind, it's more likely that they will get back into the old habits and gain the weight back again. So doing it slow and maintaining habits lifelong, long term, is a better approach. 10% weight loss in an obese individual has been shown to reduce premature death by 25%. risk of death from diabetes-related complications by 30%, death from cancer by 40%. A 10% loss of weight can reduce the blood pressure by 10 millimeters systolic, 20 millimeters diastolic. It can cause a 50% fall in your blood sugar. And it can cause a 10% fall in your total cholesterol, 15% in bad cholesterol, which is LDL, and an 8% increase in your HDL. So even a 10% loss of weight in an obese individual is not to be sniffed at. It can have major health benefits. So when we talk about weight maintenance, there are several steps. So the first step tends to be monitoring of weight. A person who is stepping on the scale in the shower or when they wake up in the morning or at night before they go to bed is more likely to listen to advice and to adhere to advice and to be self-disciplined. Self-monitoring is a very important part of developing that discipline. A low-fat diet has been traditionally been recommended, although more modern kind of thinking is more around carbohydrate intake, and we will talk about that in a second. Of course, physical activity is very important. Those people who have successfully maintained their weight often will minimize sedentary screen time, and often they will be eating most of their meals at home and not outside. These are the kind of patterns we see in patients who successfully lose weight. At one level, weight loss is physics, although again that is more complicated than just that, and there are other parameters, metabolic parameters as well. But yes, of course, caloric deficit is important. You do need to be consuming less calories in your food than the amount of calories than you are burning, and of course the burning is made up of your basal metabolic rate, so the energy used by your body for the purpose of just running your normal functions, and of course the activities you do. But to be fair, it's becoming increasingly obvious now that exercise probably makes up about 15-20% of weight loss, while the bulk 80 to 85% is more likely down to diet. So a lot of people who find that they're not able to lose weight despite exercising a lot perhaps need to work on their diet a bit more. So let's talk about the kind of strategies that can be adopted for weight loss. Well, 30 to 60 minutes of aerobic exercise 5 to 7 times a week is reasonable. And here I'll also talk about some health foods which may work. Catechin is a flavonoid found in green tea, which may aid in preventing obesity. And we also know that green tea is an anti-inflammatory and antiviral. It's a zinc ionophore. The ECGC is a chemical compound, and we have talked about ECGC in previous blogs, particularly the anti-inflammatory blog. Caffeine from tea and coffee can increase your energy expenditure because it gives you that quicker heart rate, and it'll have some effect in promoting weight loss. So if you're feeling hungry, instead having a black tea or a black coffee might be a good idea instead of eating that food. Of course, most of this work is undone by those who add sugar and milk to their tea and coffee. If you can get a habit of green tea with no milk and sugar, nothing like it. Even something as simple as drinking a full glass of cold water before meals may have some good effects, because it will fill up your stomach somewhat, and secondly, cold water is also something which promotes weight loss. What happens is it'll reduce the core temperature inside your body, and then your body then has to spend some fuel, some energy to heat it back up. Hence, cold water actually has negative calories. Certain types of vegetable margarines like plant stanols and sterols, they have been shown to reduce cholesterol by about 10 to 15%. An example would be Bessel Proactive in North America and Benecol in the UK. Although they haven't been shown to reduce weight, they have been shown to reduce cholesterol. Sleeping well is very, very important. Ideal is 7 to 8 hours of sleep. Of course, if anyone has underlying sleep apnea, and that is characterized by an obese person who snores and often can be seen to stop breathing or have pauses in their breathing while they're snoring, that needs to be screened for and needs to be treated. It's very important to have good benefits. Let's talk a bit about the type of diets that can be considered. So a low-calorie diet would be something like a Noom diet that you might have seen the ads for. A low-carb and a high-fat diet would be something like the keto diet. A low-carb and a high-protein diet would be something like Atkins. And a low-carb, natural processed, unprocessed foods diet would be something like a paleo diet. I feel that intermittent fasting is actually very beneficial as part of any diet. Now, personally, I can tell you, I try on most days. Of course, I have cheat days, but mostly working days when I don't have any commitments, I try to not eat particularly carbs after 5 p.m. I have fruit and salad after 5 p.m., but no carbs and no other major foods. I don't have a proper meal after 5 p.m. And so that's my way of doing a bit of an intermittent fast. Now, we all have our preferences, and certain people may benefit from certain types of diet. For example, if you're an athletic person trying to build muscle, a high protein diet like Atkins might be good for you. Saying that, if you have kidney disease, for example, then you certainly don't want an Atkins diet because too much protein could clog up your kidneys. Personally, the diet which I feel best about but is virtually impossible to follow, so a lot of these diets you cannot follow strictly, you just have to take some tips from them, is a paleo diet. I really do like the paleo diet. And the reason I like it is because the theory behind the paleo or Paleolithic diet is that this is a caveman diet. This is a diet which human beings were following before the Industrial Revolution and before the Agricultural Revolution. So what is promoted on a paleo diet is what we were eating naturally before the Industrial and Agricultural Revolutions. The theory is that because we were eating those foods for millions of years, that is what we are genetically best made up for. And we haven't quite adapted genetically to processed foods like flour, like processed carbs, and other processed dairy even. And that is the main underlying principle of a paleo diet. I will just attempt to share some links from paleo diet. These are common websites that I look at: Medscape, GP Notebook, and this is my disclaimer at the bottom. Let me just quickly show you the paleo diet as well, because I quite like it. This is a website about the paleo diet, and what they feel that genetically we are best suited to something like a paleo ancestral nutrient-rich diet, which is mainly fresh fruits, fresh vegetables, fish, shellfish, grass-produced meats, poultry, nuts, and healthy oils. That's the primary motive of the paleo diet. One reason that I like the paleo diet over keto is because keto also they recommend against fruits because it contains sugar, which I disagree with. Fruits, I feel, have incredible amounts of antioxidants and micronutrients and other nutrients which are essential for our health, and we have discussed those in our previous anti-inflammatory and immune boosting blogs. So a paleo diet just seems much more common sense to me than that does. And this is they have differences between a keto diet and a paleo diet here, and here you can see that a paleo diet they encourage nuts and seeds, fruits, vegetables, eggs, healthy oils, low carb nuts, cruciferous vegetables like cauliflowers, cabbages, broccolis, fish, leafy greens, and so this is really useful. So that's my talk done. I'll now hand over to Seema and I'll open up her talk. But first, Seema, I would like you to just introduce yourself, and then we'll start sharing your talk. That's me done.
Yeah. Today's talk is about holistic approaches to obesity, and let's dig into this topic. The scary reality is 1 in 5 children and adolescents are obese, and that from 1985 to 1995, rate 7 to 15-year-old almost doubled. The number of obese children have almost tripled, and this 80% of this obese adolescents will become obese adults. Now let's talk about obesity. It's in a way it is described as a lack of a physical activity and unhealthy food choices. Definition, but it is also a condition in which excess body fat may put a person at health risk. Disorder that is primarily induced and sustained by an overconsumption or underutilization. So, did you know that obesity is one of the leading cause of preventable death next to smoking? The number of overweight children in North America has doubled in recent years, with a quarter of children considered overweight or obese. Now, you want to know how do you measure this obesity? So there's a formula for measuring the obesity, that is a BMI is equal to weight to height square. Based on that, the obesity the risk if the higher the BMI, the risk is more. So the BMI classification is based, if it is normal, that is less than 25, it's a normal weight. Overweight, the BMI will be in the range group of 25 to 29.9. If it is more than 30 is obesity. But not only the BMI can diagnose that somebody is obese or not. The problem with that is, like, people who are muscular athletes find their BMI is normal than that of the normal person. The reason being, the weight is more because of the muscles, not the fat. The other thing we would like to discuss is about the waist circumference. Like, in addition to measuring BMI, waist circumference should also be measured to assess the obesity. So one more thing, waist to hip ratio. So this is the ratio of the circumference of waist to that of the hips. This is calculated as the waist measurement divided by the hip weight divided by height. Like, for example, a person with a 64 centimeter waist and a 97 centimeter hips has a waist to hip ratio of somewhere around 0.66. So the waist to hip ratio has be used as an indicator to measure the health and the risk of developing a serious health condition. Also shown that people who have the apple-shaped body with more weight around the waist face more health risk than those who with pear-shaped bodies who carry more weight around the hips. So, what are the other health problems associated with obesity? Like type 2 diabetes, eating disorder, orthopedic disorders, liver problems, including fatty liver, respiratory disorders, sleep apnea, cardiomyopathy, a problem with the heart muscle caused when extra effort is needed to pump the blood. What are the causes? The modern day causes are the changing society, food choices, lack of physical activity, family eating habits. Some examples, like why this happened: the cost of the food has decreased, prepared away from home. Then energy dense foods, like foods are is readily available. Portion sizes have increased, and then there is a marketing of energy dense food drinks have increased. Sales have increased. The one example I would like to share is about the Starbucks, a simple Starbucks coffee or a frappuccino that has around 50 to 60 grams of sugar. If you don't know how much sugar it is, like, it's a lot of sugar for that drink, right? So Then we can also see some of the medical complications of obesity, like non-alcoholic fatty liver disease, gallbladder disease, skin issues, gout, coronary heart disease. How some of the diets fail, because the thing is with diets, what happens is you stick to a diet for some period of time and then you just give it up. So the most thing, it is not about the willpower and appetite control, it's mind versus food, and food will always um, what can you do to support the chemicals related to food? Like foods are like drugs and they affect the chemicals in our body. Get a chemical reaction, as there are two hormones, the hunger and the satiety hormones. So let's talk about the satiety hormone, that's the leptin. Hormone that is secreted by stored fat. Stimulated hunger gets shut off and stimulates the body to burn calories. That is what we want. But when we override leptin by our pleasure center, these people have high leptin levels, a lot of fat, but they become resistant to leptin. So how do you stimulate this leptin? Exercise, losing weight, and you respond better to leptin, making you feel full. That we are going to see is ghrelin, and this is the hunger hormone. The stomach releases this hormone when it is empty. So if you are dieting, basically what happens is ghrelin increases, giving you more signal to eat. So simple sugars, like whenever you have simple sugar, it's quickly absorbed and you feel good. And fiber, what happens is it takes longer to digest. Proteins, if you are inactive and then there's no need to bulk up the muscle, then what happens, it stores as a fat. And fat, basically whenever you indulge in bad fats, that contributes to obesity. There are some strategies for satiety in snacks. So healthy snacks make you feel full. A high fructose corn syrup doesn't fill you up, so the body wants you to keep eating more. Carbs cause your liver to be overwhelmed by fructose, which will cause liver to make inflammatory substances. Now, satiety, CCK, this is a hormone that senses fat in the stomach and tells the brain that you are full. So leptin is a long-term indicator of satiety, while CCK is a short one. So high saturated fats make the CCK less effective. There are a few tips that you can follow. That CCK simulation and ghrelin reduction takes 30 minutes to work. So make sure you eat small snacks before a meal, like some complex carb fiber. What it does, it slows your digestion and increases your satiety. So be the last to finish at the table and make sure you eat in small, using a small serving containers. We can talk about inflammation, food allergies and sensitivities, bacteria, toxins, all inside inflammation and causes the immune response, which worsen inflammation. Inflammation, what it does, it interrupts the glucose getting into the vital organs like brain. And so what happens is, so the brain tells you to eat more, which starts the whole cycle again. We can, when we talk about stress is whenever somebody has a bigger belly, that indicates more level of chronic stress, higher the stress. So the inflammation occurs in the small intestine, but in the liver, most of the inflammation occurs from fructose, and where it is decided and it is stored like a fat. So that is why the fatty livers are on the rise. About the two types of stress. Type 1 is the acute stress, that is more like a fight or flight response. And basically this type of acute stress is good for you because this is a good stress. You exercise and then you lose weight. The second one is more like a chronic stress. What happens is it slows down your metabolism in chronic stress. So under stress, stress, we release a hormone called as cortisol, which is a good for a short term. But if the cortisol is there for a long term, what happens is it binds to the cortisol, the momentum binds to the cortisol, and then this uptake of cortisol messes with the insulins. So then you become insulin resistant, and causing this the liver to receive more fat from momentum, causing more inflammation. So this is just like a cycle, the stress cycle. So what happens, you are stressed, you go into bad eating, then you store fat in the momentum, then fat and inflammation is pumped into the liver, then again it causes insulin resistance, pancreas secretes more insulin, then you again get hungry, then more eating. So this stress cycle continues. So some of the brain chemicals that influence our eating, that is the non-epinephrine in fight or flight, the serotonin that makes you feel good, that is SSRI, your reward system sensitive to addictions. Now about cravings, like some people crave chocolates, some people crave for ice creams. So nobody, it's too bad that we don't crave for a vegetable. That's the part. We don't crave for a celery or anything. Like whenever somebody craves for ice cream, you know that person is really anxious. Who is depressed craves for sugar. And these kind of cravings, you know, like somebody only craves for salty food, that is the adrenals are stressed out. Anything or everything, like you have a jealousy feeling, you crave for everything. So how do you satisfy your foods that give immediate rush of serotonin? Sugar stimulates serotonin release. To avoid the lows, just like drug addicts, like omega tryptophan, that is found in turkey, chicken, and dark chocolate, sleep, sex, and stress reduction. More basic lifestyles tips for a healthier life. Um, First tip what I would like to give is drink plenty of water. Like people, what they do, they confuse the thirst with hunger, and if you are even more mildly dehydrated, your metabolism may slow down. So in a study, it shows that adults who drank more than 8 or more glasses of water, they burned more calories than who drank less water. Careful nighttime snacks. So mindless eating occurs most after people just relax and they sit down at night after dinner. Snacking in front of the TV is one of the easiest way to throw our diet, of course. Either close down the kitchen after a certain hour or allow yourself a low calorie snack. Enjoy your favorite foods. Instead of cutting on favorite foods altogether, be a slim shopper. So buy one fresh bakery cookie instead of a box, or a small portion of a candy from a bulk bins instead of a whole bag. So everything, the key is moderation. Several meals. If you eat fewer calories than you burn, you will lose weight. But when you are hungry all the time, eating fewer calories can be a challenge. So snacking, it increases satiety. Protein in every meal. It's a very important thing that protein is ultimate fill me up, satisfying than carbs or fats, and keeps you feeling full for longer. It also has to preserve your muscle mass and encourages aging. Now, tip nuts. Nuts can be high in fat, but it is also a good kind. They are also rich in protein and fiber, which can help stabilize the blood sugar. Studies show small amounts of this favorite control hunger without causing weight gain. Tip 7, check your vitamin D levels. Vitamin D and weight gain. After studies has found that after menopause, most women gain weight until they reach mid 60s, and there is an evidence that taking a vitamin D may slow the weight gain. In one study, women who were not taking enough at the start were likely to gain weight and more likely to maintain their weight or even lose weight as a result of taking the supplement. And tip 8, caffeine. Coffee only falls in the bad category when you add cream, sugar, or flavored syrups. If you drink it black, you get a metabolism boost without adding fats and calories. Besides, the caffeine in 2 cups of coffee may cause a 145-pound woman to burn 50 extra calories over 4 hours. Tip number 9, drinking more water. The body needs more water to process your calories. So if you're even mildly dehydrated, will slow down. So it's always good to have 8 or more glasses of water. So what's the healthy plan? The healthy plan for weight is the main goal for obesity management, and you can reach by making good treatment plan with either your doctor or a big team of nutritionists, dietitian, obesity specialist, and nurse. This plan may include dietary changes, exercise and activity, behavior change, prescription medication, weight loss surgeries. Then what are the things you can incorporate? Eating colorful vegetables and fruits, green tea, eating dark chocolate, regular exercise, drinking at least 3 to 4 liters of water every day, maintaining a healthy weight, avoiding saturated and trans fat. Always better than the treatment. As if you currently overweight, your body mass index exceed 30, you need to start your prevention program. More about exercise, around 150 to 250 minutes of moderate intensity every week is helpful to keep you away from this. And this activities such as fast walking, swimming, healthy, low calorie and fiber rich foods such as fruits, vegetables every day. But saturated fats and sweets and alcohol are extremely bad. They increase your body weight and threaten your health. It's always good to monitor your health and calculate your BMI, which will be helpful to know your prevention plan is working. Those are some of the strategies that you can incorporate in your life.
Thank you so much, Seemaji. Thank you.
Thank you, Seema. That was incredible. That was very, very useful. I'm sure a lot of people will benefit from this. And we have multiple people watching on YouTube as well as Facebook. And if they have any questions for our in-house nutritionist, then you're more than welcome to ask her a question. Ashish, welcome to the talk. It was a late night last night, Valentine's Day party.
Thank you, Sapan, and sorry, Seemaji and Sapan. I just woke up, and I immediately joined. So I'm sorry. I will go through your presentation, your blog. Sorry for it.
It's better to come than not come, Ashish. Thanks for coming here. So, Seema, from your talk, there were a few things that really picked up on. I'll just mute you because Google Meet is not, the sound is not very good quality if multiple people are talking at once. There were a few things which I found very interesting. And these are tips that I have used. These days with the pandemic, we tend to stay home most of the time. So you can just have any kind of, I go to the office, I go to my clinic twice a week, but most days I'm working from home. And it's easy to follow your whatever kind of pattern you want to follow. So I can start like some form of intermittent fasting from 5 p.m., not have dinner, only have fruit and salad after that. But before that, I remember when I was working long days, 9 to 5, for example, and then driving home to work and starving and, ready to bounce upon the meal. What I used to do is I used to have an apple that I would eat in the car while I was driving back home. Like you said, have a little fiber-rich snack before your meal, so you're not completely starving and you don't end up overeating when you get there. Also, we have this Indian tendency that if there is food in front of us, then we have to finish it. That tendency is also kind of dangerous, especially children. Children, they leave their food and parents, they eat it up. That's my biggest problem. And so you have to find ways. I mean, the way I find it is, don't be there. You know, I just avoid that spot. And what we try to recommend to the kids is pick up your own food. You know, we don't put food in their plate. They pick it out of the pots and pans themselves. And but the deal is, whatever you pick out, you have to finish that. That's the deal. So that way they don't waste any food, and we're not forcing them any food. And also there is a link up between force feeding children and obesity as well. As you are probably well aware, that if that center in the brain which tells you that I'm done, I'm full, this is enough, if you dampen it in childhood by force feeding children, then later on in life as well, they don't have that center in their brain on how to know when to stop food. One more thing I found very useful in your talk was a talk about water and green tea. So many times you're working, you've been on the phone for 3 hours, or you've been on Skype dealing with patients, and then you come to the kitchen a bit dizzy and you're looking for food. You're looking for biscuits or something. At that time, a lot of the time, actually, you're thirsty. You're not even hungry. You don't realize that it's thirst, not hunger. And if you just drink some water or make yourself a green tea, you probably won't need that biscuit or that carbohydrate snack. So those are some really useful tips I found in your talk, which I have implemented in my lifestyle as well. Not to say that I have a perfect lifestyle, but do as I say, not as I do. So Seema, one question I had is, high fructose cornstarch. High fructose cornstarch is all the rave. We know it is bad, it is processed, and we talked in our anti-inflammatory blog, if something increases the shelf life, it probably decreases your life. All these kind of preservatives and processings which are pro-inflammatory, they cause fatty liver. But and particularly high fructose cornstarch is something that I'm always looking out for. But in your experience, what kind of foods that contain that, and what kind of foods which sometimes we consider safe, for example, flavored yogurt, for example, what kind of foods have you seen, or salad dressings, the other one, which contain high fructose cornstarch in your experience? You just unmute yourself first.
In my experience, I have seen high fructose corn syrup in most of the bakery items. Then sauces. This is basically they don't use the sugar, they process the corn in such a way. And the thing with the corn is it's a GMO corn, modifies. So altogether, these are all the when you have a little bit is enough for that. I have experienced it myself. Whenever to know that you have a sensitivity to certain type of food, you can try it once. It reacts to it. Not having it for a long period of time, you won't know it. But if you are having it always, you think, oh, it's a part of my problem. Like, it's how I am. That's a normal thing. Have it after a few times, like you can see the difference in your body. Like you will have some aches or pains, some joint issues, something it will show on your skin, right? It's not that you need to have more of it. A little bit is just triggers that sensitivity in your body. Because of all this, body is in that inflammatory mode, right? So it produces all the inflammatory markers and all, and then you end up thinking, oh, what happened, what did I eat? And this thing with it doesn't show it right away, it shows after 72 hours. So you think, oh, 3-4 days I ate something and now it is not related with that food, right? Your liver gets so taxed out with all the processing, like it is not able to go to the next phase of detoxification. Like 3 stages of detoxification, the first stage itself, it is like stuck able to, because you don't have proper nutrients to metabolize everything. So what happens, it doesn't go to the next stage, and then you feel a sluggishness, like you don't have that energy, right? So what you have to be very mindful when you're buying everything. That is the first thing I can say. Read at the ingredients, and always make sure that you always shop the perimeter of the store, not inside. The inside part is all the junk. Always keep that in. The perimeter is the part where you can just go around and have a look at everything. because it doesn't say the ingredient, right? Whenever it says the ingredient is there, then you have to do a research in chemistry to find out what that ingredient is and how it is going to affect you. It makes you so addicted. That is one thing, right? When you go to Costco, you eat a chip, you cannot just eat one chip, so it tricks your brain that you want it more and more and more. So this is one thing. And better way, stay away from all those.
Yeah, I think there is this big fatty liver is also another very interesting topic. Just the other day, yes, yesterday, I had a patient with fatty liver who started telling me that he was starting to get pain in all his joints. Young patient. And I had to then explain to him how this is an inflammatory condition and it can also trigger other inflammatory conditions, even autoimmune conditions in some conditions. And a lot of these patients have been told, hey, you know what, I was diagnosed with fatty liver 10 years ago when I was 26 years old, and my doctor in India told me there's nothing to worry about, doesn't matter. And I tell them, well, I'll tell you what, fatty liver doesn't matter for your liver. When they say it doesn't matter, what they mean is it doesn't matter for your liver. The reason is for you to develop a very small minority of patients with fatty liver will develop non-alcoholic steatohepatitis, NASH, and a very small minority of them will develop cirrhosis, end-stage liver disease, and they might even die. But that process could take 25 years. But that patient has got much higher risk of dying of a heart attack or a stroke in the next 15 years. So the fatty liver doesn't matter for the liver. The liver is a regenerative organ. It can deal with itself. The problem is the underlying inflammation, and it's much more likely you'll end up with a heart problem and succumb to that than liver failure. And so when the doctor says it doesn't matter, what he means is it doesn't matter for your liver, but it does matter for you as a person. It matters. And sometimes I feel as physicians, we've somehow lost that holistic touch that, I feel very fortunate to be a family physician. A family physician MD means we deal with the whole patient, the whole body of that patient. It's not just I'm just a liver specialist, that the fatty liver doesn't matter for your liver. Well, it matters for you as a person because it's an inflammatory condition. It will increase your cardiovascular risk. And so I think it's very important, all of us, regardless of what kind of work we do in the medical field, we need to become more holistic and we need to become more all-encompassing, and that we need to look at the whole patient as a person, as an entire person, and deal with that. Yeah, so I think inflammatory conditions very important to identify and then get in the interventions quick, be it dietary, weight, exercise, all of these. So Seema, I also want to hear from you because both of our talks talked about low fat, but however, the more modern kind of way of looking at it, be it the keto diet or be it the paleo diet, is that fats are actually quite useful, especially the healthy fats are quite useful because they do have satiety. They keep us full for longer. If you want to do some degree of intermittent fasting, for example, a fatty meal actually helps to maintain for that fatty meal, to maintain that fasting, and the fact that the processed sugars are the bigger enemy, as we are now seeing it, the refined processed sugars. So Seema, give me your thoughts about healthy fat versus not so healthy fat, and also healthy fat versus what we think is a bigger enemy, the processed refined sugars. Okay, over to you.
Like when you look at all the nuts, like cashew nuts, then avocado oil, and like some fats are really healthy, and avocado oil, cashew nuts. So what basically it does, it helps, goes into satiety, so your body is able to burn more calories, right? So what happens is a few hours you don't have that craving to have something, because the thing with the craving, that is the part, right? If your body is depleted with all the nutrients, you always crave for something. For chocolate is like your body is nutrient deplete in magnesium. Thinks that, yeah, okay, sugar. Why I am craving for sugar? The nutrient chromium. So the thing is, with each and every nutrient, right? If you don't eat a proper meal, what happens is, after 1 hour you are again thinking what to eat. So that triggers, right? So it's not like always your mind is having this thing, oh, I have to have a chocolate. It's not like you want to eat it, but you get more to have it. That craving, that is also important, right? People don't realize that. They just buy a bag of chips, they sit and watch it in front of the TV, they keep eating it. So what happens, you always in this feeling, okay, I just ate this, why am I still feeling hungry, right? Proper meal, and if you sit in front of the TV, then you don't feel like eating, basically. And what I have seen in most of the cases, right, when you go to a movie theater, what happens when you go there, the smell of the popcorn will attract you in such a way that, yeah, that you feel it's buttery, you think it is good, but basically it's tricking your mind to eat more and more. Drink. So this addiction, next week again you go for the movie, you do it again. So it keeps repeating again and again, and it becomes a habit for you. So you cannot come out from that, right? So that's the habit that you are just having.
Yeah, I completely agree, Seema. There are certain things that I really find that if you can just incorporate into your life, like this is not for everyone, but I try to incorporate some degree of intermittent fasting. So I have my cheat days. If I'm meeting with a friend outdoors, I'll have dinner late as well. But I generally try not to eat after 5 p.m. Just a form of it, because that does have some very good metabolic effects. You burn, you're burning the sugars, and you're cleaning and detoxifying your liver when you do that. Of course, it does come down to self-discipline, be it fasting or not cheating, and it comes down to self-discipline at the end of the day. On top of that, certain other habits if you can inculcate. For example, a snack, or, well, try to snack as less as possible, first of all. Snacking is a major problem. Too much snacking is a major cause of obesity, first of all. Secondly, if you do have to snack, try to do something which is more healthy. Just use hummus and celery sticks, or use carrot sticks, or something like that, which is much more, it's not processed refined carbs. I mean, 99% of our snacks, be it Indian snacks or Western snacks, are refined carbs. So if you can try to move away from a refined carb snack, that's a huge difference that you can make to your health. And thirdly, just drinking more water and green tea, it can have major impacts. Drink a big glass of cold water before a meal. Whenever you feel hungry, instead of grabbing a packet of Parle G or some refined carb biscuit, make yourself a green tea and drink that. And those little changes that you can make on a daily basis, I feel, are much bigger than a lot of things. So Seema, just your opinion, and what experience you've had with your patients with these kinds of small changes that people can make to their habits.
Yeah, like one of my client, like she has this, like she's always, when you're always depressed and all, right, you find food as a comforting thing. So whatever is in your convenience. And the thing is, she is a student now, she is doing her PhD, and what happens with her is, when she comes back home, she doesn't have the time to cook. So whatever is in the convenience, she tries to do that. So I told her to incorporate few things, like whenever she goes to grocery store, make sure that she should plan that week ahead of time, because if you don't have that planning, right, you end up eating anything. So once you have that plan, yeah, today I will buy a few vegetables, as you told, celery sticks or cucumber or apples or fruits. Like if that is handy at home, that you will just go and grab it and eat it. But if you always go buy a lot of junk and keep it, everybody will eat it, right? So So small changes, that mindful thing, right? When you think about it, the amount of sugar, yeah, should I really eat this, is because with my family also, I always tell my son, whenever he goes and picks up something, right, for example, he's taking a juice and then he's looking at the bottle, then he will tell me, oh my god, this much sugar is there. So that awareness as early as possible, that is very important. Since like they are child, it's better if they know it early, so they know, okay, no, I should not have this is not good for me. If they don't have that awareness, then it is very difficult. Yeah. Small things, that is how you can incorporate. As parents also, we do it also. So always make sure you take them to the grocery stores. That is where everything starts, right? Otherwise, the thing is, they don't realize that when they grow up, they will also think, oh, convenience, I will just go, just grab some chips, cookies, I can eat it. But when they have this thing, going, buying something, cooking, making from scratch, then they know, okay, yeah, this involves a lot of time.
Yeah. Seema, tell me about childhood obesity. That is something I get very concerned about. Because there is very good
Yeah,
evidence that if a child is obese, and because that's the kind of habits that
yeah,
the parents have inculcated,
yeah.
they're likely to be obese
It's
adults. I mean, how do you deal with that situation? It's very tricky, I think, sometimes, because
the
a lot of parents consider their golumolu child to be, a healthy child. They feel that's
yes.
the beauty. They think that's a very beautiful thing, not realizing of the health risks associated with that. So how do you deal with that?
The thing is, whenever, like, some of my friends and some families having kids who are having that type of concerns, right? To know if they were delivered, first of all, that is very important. If they were C-section or they were normal delivered, right? See, with C-section, what happens is gut microbiome when they are born. So what happens in, so that makes a lot of difference in their life, right? And based on that, then I asked a lot of questions. So what if a child does something good, you treat the child with the chocolate, oh, you do this, I will give you a chocolate. So parents are getting into that, giving that thing, right? uh, like a reward, like they feel okay, like basically it triggers that dopamine. Okay, if I do something, I will get this. So what happens is, this two neurotransmitter, the dopamine and the serotonin, right? What happens when dopamine is in excess, they always think they want that pleasure seeking, the food addiction, right? Whenever they eat junk, they crave more junk. That is what happens. And if the parents are not aware, okay, they don't care, okay, we just go, we eat every time outside, and the child just wants that again and again and again, that the cycle will continue over a period of time. Training the kids, watching different types of that is what I would recommend them, watching different health documentaries, be more aware of what they are eating, how it is affecting their health. So that is one thing I would like to always tell them. And I will research some documentaries, and then I will send them the links. So the thing is, the awareness, the early it comes to them, the early they can incorporate in their life. Nobody is perfect, we also don't know many things. So when you learn something, then you read more about it, and then you implement it in your life and you share it with others. So that's what I keep doing with my friends and all, because I have seen many kids having this they are very moody eaters, they don't want to eat anything, like they have their own way of dealing with emotions, right? Kids. And the parents thinks, okay, the child is eating something, I'm happy with that.
Um, One thing I would like to add
Thank you.
is that I find that, especially with children, one concept which is very important is respect your food. Now, respecting your food doesn't necessarily mean you have to finish all your food, but you want to respect your food. And how do you respect your food? Simple things like eating slowly is very, very important. It's too many people eat too fast, and actually, they're not even tasting the food. They're driving, you see people driving in a car and they're munching down their food, and they're not enjoying it. They spent money on it. They maybe spent some time preparing it. Unlikely they spent any time preparing it. More likely they just bought it. But anyways, but they're not enjoying it. So the concept of a family sitting around a table at meal time, and properly having a meal where you are talking to each other, you're interacting with each other, and like I said, having some basic rules, like you pick out the food yourself, but whatever you put in your plate, you finish. So having some basic rules and respecting your food, spending time chewing your food properly, so that it is well digested, and then also that helps you not overeating, and then not eating at times which are not meal times, not excessively snacking. So while you're walking to the bus stop, you don't have to be eating chips while you're walking to the bus stop. While you're in your subway, you don't have to be having a can of Coke during that time. It is not important. You can have a bottle of water as well. It doesn't have to be Coke. So simple things like that. And I see people, like you might see someone, and you can see the person is morbidly obese sitting at a bus stop with a bag of chips and a can of Coke, and you think someone needs to give this person some advice. Not only are you eating stuff which is high calorie and is triggering that dopamine, and you're addicted to this, but also you're not respecting your food. Food should be eaten properly on your dining table. It should not be eaten at a bus stop. So some basic concepts like that can also help in that next step to a more healthy life. Seema, what your experience on that?
There should be that. The thing is, eating without any distraction, challenging thing these days. Everybody has a cell phone in the hand. They will be watching videos. It's like yourself to eat something. That is how it is in the today's world. That is what I have seen. That either they have to watch the TV or they have to eat. The senses, right? As you told, when you eat, you should enjoy it. Your senses is knowing, yeah, now you have finished eating, you're full. The thing is, your brain, after eating also, when you're watching a TV or a movie, you're not registering that food in your brain. Stop it, it's done. Always distracted. So take away all the distractions, sit, enjoy your meal, and then eat slowly. That is really get the benefit of that food.
I will just add to that. If there is one thing which is probably the most important message, last time we did a talk with Seema, we had a one-line message. It was about inflammatory foods. The blog it's on the blog and YouTube. But the message was, if something increases shelf life, it probably reduces your life. Today, if there is one most important message, this is it. This is this one. Respect your food. And my request to everyone watching on Facebook, on YouTube, if you're one of those people, or if you know someone else who's feeding their children in front of an iPad or feeding their children in front of a television, please tell them to stop doing it. Please wean off that habit. It's a really bad habit, because what happens is, when we are watching TV, we are focused on the TV, we're not focused on the food. One, we are not respecting our food. Two, we are not developing our system in our brain which tells us that we are done, that we are full, and it's enough. And because we're distracted, and what we do, whatever we see in front of us, we just finish it without thinking about it, without even tasting it a lot of the time. And children are developing, their brain connections are developing. If you keep stuffing food into their mouths while they're watching an iPad or watching TV, you're not allowing that brain connection to develop. And that is a recipe for disaster in the future. That's going to lead to obesity and all these problems in the future. So please, if there is just one thing that you have, this talk has been going on for more than 1 hour. If there's just one thing, please stop feeding those kids in front of iPads and TVs. That would be the biggest change that you can make to society going forwards. Seema, your thoughts?
See, that will be a big challenge for parents. That is 100% sure, because the thing is, they are used to this thing, right? Oh, you eat, watch the TV, at least the child is eating. They feel happy about the child is eating. That's it, right? Other than that, they don't worry about it. it is a challenge, but slowly I think it's better to always take the food out, like the distraction. It doesn't matter, it's a phone, iPad, or a TV or anything, right? Just be with the food. And also the thing is, as you told, respect the food, right? Cooking at home, the effort the person takes cook it, right? So that's all a lot of work going on in that. You're just getting the end product on the table, and if it is not there, right? It's of no use. Yeah, so
Seema, I have a
the early
question.
they know, the better it is.
I have one more question for you.
Whenever, as you told, like for kids, with my son also, whenever he leaves something, like after eating he leaves something back, I just think, oh, I don't have to waste this food, because we took so much effort to get it here, and then we end up eating it. Better they have little bit, they eat it, and they understand it. You
Correct.
have to be a little bit strict also with this. That is what I feel, because if you just leave it like that, then they will.
But it comes down to discipline, isn't it? Discipline of yourself,
Yes.
discipline with your children. So, Seema, I have one more question. Now, there will be some patients who are being advised, for example, surgery for weight loss. They might be morbidly obese. They may feel they're well past it, but
Mhm.
I always feel, I mean, it may have a role, it has a role in certain patients, but by and large, we're not losing weight just to look nice. We are also losing weight as part of a journey of becoming healthier and, adopting a more natural, anti-inflammatory diet and exercising
Yeah.
more is part of a journey of becoming healthier. So it's not just about weight loss, it's also about becoming healthier. And I just feel, and this is what I tell my patients as well, who just are looking for a quick solution, give me some tablets so I can lose my weight. And I tell them, listen, it's just not about the cosmesis of it. It's also about the fact you want to become a healthier person. So if you eat healthier, if you adopt those better habits, if you exercise more, then you will become a healthier person. That's more important
Yeah.
than the weight loss. So those people who are significantly overweight and who feel that they've come to an age, maybe they might be 50 years old, 55, 60 years old, where they feel that it's too late for me now, I can't make any changes, I should have done it earlier. What is your message for those people? What hope do those people have in your view?
See, anything with weight loss is not like a quick fix. You take a pill, you lose weight, because you took so long to get to that stage. First of all, it's not like it's a magic pill, it works. And the diets that promote this magic pill will work in few days, few months. You will get back to the same weight again. That is what happens, right? But if you're slowly losing the weight, see, everything takes that small change, right? Accepting that, yeah, you are overweight, you have to work towards it. It will take few years for you to reach to that goal. That awareness that person should have in the first place. It's not just you eat. See, that is the thing, right? With most, like, I have one of the client in Dubai, and the problem in Dubai is there are a lot of people who are in that obesity group, and they all want a quick fix. They just want to have this, and the thing is, they don't want to make other changes in life. That, right? Other changes is starting from everything, like eating. There are so many factors, right? You just don't want to do anything, and you just want to. So it won't work like that. Take that responsibility first for your health, rather than complaining others. Oh, because of them I am like this, right? So it's your own health. I will, unless and otherwise the person is really right, you cannot do anything that with that person, then the doctors may suggest a surgery or anything. Other than that, what I would say, that it's better slowly, small steps, right? That will be much better. I also dealt with somebody who did the gastric bypass surgery and all. But the thing is, long term, what are the effects, right? They have lot of deficiencies. So the thing is, then that becomes a very big challenge. It's more than losing weight. It's like you have to maintain your health, right? That is a challenge. So then you have to be like you get into other health conditions. but you are getting into other health conditions. That is what I've seen.
True, true. We have Ashish here, who's back on camera now. So, Ashish, do you have any comments, any suggestions, any views, any tips you want to give about your healthy lifestyle? Because I know you live a very healthy lifestyle.
Thank you, Dr. Sapan. And I agree with you and Seema ji also what you mentioned. But, I have a completely different philosophy. And nothing is right, nothing is wrong. My philosophy is, there's always an equation. We put too much focus on food, 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 but we have forgotten that the other side of equation is you need to burn calories. So kids, we want to snatch their chocolates, we want to snatch their snacks. That's fine. But how many parents have put their kids in a swimming program? How many parents have put their kids in a soccer program? I will give you an example. My middle daughter goes and she makes 30 laps of pool in the program, and she eats everything, and still she is hungry because the body needs that thing. So I agree with that, but we need to change our lifestyle. Seema ji mentioned one really good thing. We want teriyaki chicken, we buy teriyaki sauce. It's full of chemicals. Why people are buying teriyaki sauce? Because everybody wants to have, an easy life. Nobody wants to cook. Everybody wants to order from restaurants. Nobody wants to make that teriyaki sauce from scratch. So it's our lifestyle. So there's a lifestyle change. Summer is going to come. I have not seen anybody working in their backyard. You just dig 10 by 10 foot of area, your muscles will be sore for 2 weeks. They need, body needs, even when you're resting, so body is going to burn calories. So eat. My philosophy is we eat. We don't eat junk food. I never cut on my diet. If I have to eat 2 chapatis, I will eat two chapatis. I will eat salad. I will eat chicken. It's a complete balanced diet. You need to have 25% protein, 25% fiber, 25% this, that. Eat 5 fruits and stay a healthy life. We don't want to order groceries, go for groceries. We want to order groceries. We want people working in our house. Just change your lifestyle. You will see a big difference. Change your lifestyle. That's and along with what Seema ji mentioned, food. That's my philosophy. It's nobody's right, nobody's wrong.
Very good philosophy. Very good.
Yeah, completely agree, Ashish. Very good, very valid points. But for patients who are already obese, the studies show that exercise contributes about 15 to 20% to their weight loss, while diet contributes more like 80 to 85%. And I have experienced that myself. Over summer, I was every single day I was playing tennis for about 1 to 1.5 hours, singles outdoor tennis. Despite that, I did not lose any weight. So, because if you look at one can of Coke, if it has 110 calories, you need to run on the treadmill for 30 to 40 minutes to burn that one can of Coke. So the balance is so swayed in favor of the energy dense foods that we have, that you have to really be very, very active to be able to do it just by that. Some people are gifted with faster metabolism. Their basal metabolic rate is faster. They get rid of stuff, and no matter what they do, they never look overweight. Mind you, a lot of those people, they don't have fat cells becoming bigger. They have fat cells multiplying, and they have more internal visceral fat, more fat around their belly. So a lot of those people look fit, but actually they're still at risk because they could be developing fatty liver. They could be getting internal fat as well. And so you're right. Exercise is very important. But certainly for an obese person, diet will be a big part of what they need to do as well, along with exercise. Yeah, absolutely.
Yeah, I agree, and I'm not denying that diet side. But I give you my personal experiences. If I don't eat a nice meal, I don't get a good sleep. So then you cut calories on a good meal, then you crave for this thing, that thing, whatever you find. And then fruits are also good, but then you keep on adding sugar. Another thing is, it's we read and we get. I had a trainer, personal trainer. He taught me a lot of things, and one thing is when we cut down on our food, what happens is the first thing, the body needs energy. It's a path of least resistance. So first is readily available carbs. And if you don't have readily available carbs, then it's going to go straight extract sugar from your muscles, and then muscles will disappear. So one thing is, a person can be 170 pound, another could be 170 pound, but both of them may have different density of muscles. So more muscles somebody has, the more energy, more food, even if that person eats a lot or more than the other one, the body, it will not stay around the belly or waist. So food is, of course, 75%, you're right, 75 to 85% is we are food. And I'm not denying that. Food is the most important. And what Seema ji said, don't go for chips, this thing, other thing, junk, anything in excess. And sorry, I missed the first part, so I will go through it. It's all good, very good. Yeah. I just wanted to add a second dimension, the other side of the equation. And I'm not denying that food is one of the most important factor. Yeah.
Very important. You know, Ashish, it reminds me of that Olympic swimmer, the Olympic gold medalist. I can't remember, Michael Phelps, I think his name is. I think he has like a 12 egg omelette, for breakfast, so, but he's doing a lot of laps at the swimming pool. So you're right. I mean, if you're burning the calories, it doesn't really matter. And in fact, you need all the energy you can get if you're that athletic. But that's, in honesty, with the pandemic and everything, it's very difficult for most people now to be that athletic.
Yeah, the thing is, the requirement for proteins, or the protein requirement, it changes from each and every person, right? The same requirement, like if I'm not doing anything, I don't need that much protein. Basically, what will happen then, right? It will store it as fat. So if a person who is really working out, running around, doing gym activities, everything, they really need that much protein, because the body is in the process of breaking it down and building the muscle. So they will need it. So right, somebody is doing something, okay, they are having protein shake, okay, but what else they are doing with that protein shake? Are they just sitting having the protein shake and sitting down, or are they doing some workout? As he told, you should be in that physical active, right? You should be very active.
I would like to just invite Pooja ji. I don't know if she's listening in right now. I can see her on the screen, but I know she's quite knowledgeable, and she has shared some on our group. She has shared very useful tips as well. So Pooja ji, if you're there, then feel free to give us your tips as well. And parents, daddy, mummy, aapke kya, how do you feel about this whole topic? And I know both of you are, touch wood, in good shape, but any tips you have for other people who are not in good shape? Several of our family members are not in good shape, are morbidly obese. So, I mean, do you have any lifestyle tips you would like to give them? Anything that you do that you feel they do not do, which is the difference between why you are in good shape and why they are not in good shape? Would you like to give some tips from your life?
Thank you, Sapan. Your dad, your papa will say. Thank you.
I would only say that we have to be moderate in everything. Whatever we are doing, we have to be moderate, not extreme. So we can't fix because when we are speaking about this dieting thing, then we are talking in general, but individually it may differ. So everybody has to be moderate. And another thing regarding water consumption, I heard that 3 to 4 liters of water, about 8 glasses of water, like that. But that also depends on one's physique, I think, individual's physique. Not all the people can take that much of water. And there is one disease also. I think if we take plenty of water, then there is a disease also that follows. So that needs to be taken into consideration. Third thing, I would just narrate one thing that I have experienced here during COVID. Nani, my mother-in-law, Sapun's Nani.
My mother.
She's 95 plus
95.
Of age, and she had extreme craving for sweets, Indian sweets, and ice cream. And now she has been with us, and because of this, she had ulcers in her mouth. She had feeling as if wind is coming out of her ears, and she had depression, deep depression, lot of things, And then she came over here, and during COVID time, I said, okay, she always, first thing, whenever I would go out, she would say, bring ice cream for me. Bring bring sweets for me. And I said, it is locked down. Everything is closed.
Not available.
It's not available. Nothing is available here except milk. In milk dairy, you will find only milk and nothing else. And the sweet shops are all closed. And actually, at that time, they were closed. Now, after 10 months, she has none of these problems.
She's quite healthy. Both are quite healthy.
She's quite healthy, and she doesn't remember also now.
Sometimes I give them chocolate biscuit.
And one thing that Sapun was telling, living in hills, that there could be time when people are not getting enough food. Well, that may be one factor, but another important factor is even these days that when we go to hills, then we have to walk down, up and down. I mean, we have to carry our weight. It's not that when we go to hills, then we are just sitting at one place and asking people to do this for me. This one has to do those things personally, and that way one can control one's weight. It's good for good exercise, very good exercises. Strolling up and down, and carrying some weights also. I do that personally. Every year I go to my village, and I go about 5-6 kilometers. Though there are buses also and other transport also, but I go on foot, walking down and coming from the shops. I carry some weight and come up 5-6 kilometers of height, walking. So that's the way, So those are the things I wanted to add through my own experience. Thank you.
My parents are 95, 96 years old, but they are not diabetics. They can eat sweets, so I cook for them something, dalia, kheer.
Let me just explain I'm just going to explain the thrifty gene hypothesis again, and then I'll allow Seema to reply on the water question that Daddy talked about. But the thrifty gene hypothesis is that when we were living a life like a camel, where we were going from famine to feast, and also when we were working very hard, like in the villages, in the hills, we have to walk up and down hills a lot, we have to do a lot of energy. The body wanted to conserve energy. It wanted to conserve, and that's why it would cause more fat storage. It would cause more glycogen storage. Your liver would store more sugar and glycogen, and your tissues would also store more fat, because that would be like your backpack. Whenever you go outside in the village, you also always go with a backpack. You have to keep some things in your backpack, and that was your backpack. That the belly and the liver was your backpack at those times, and it was survival of the fittest. People who had that storage capacity would survive, and people who did not have would not. And the Darwinian survival of fittest theory, that's how your genetic makeup changes. However, when all of a sudden those people have been put into a city dwelling situation where they're not active, where they're getting lots of readily available high energy dense foods, their body, the genetic makeup still wants to store all that energy. and that is where all the problems run in. That's why I've seen among my own Uttarakhandi community, I've seen high numbers of diabetes, obesity, because, and that is explained by what's called the thrifty gene hypothesis. So, Seema, do you want to answer about the water question Papa was asking?
About the water question is, yeah, 1 second. It all depends upon the body weight. So there's a rule, like a rule, like when your weight in pounds, you divide that by 2.2, and then if you're younger than 30, then you multiply by, there's a formula for it. That formula, it will tell you the ounces of water, what is sufficient. Not for everybody 8 glasses is enough. Like, so for some people 4 to 5 glasses is enough. See, it's not people drink out of thirst, but metabolism, you need this much ounces of water, right? You have to put it in that formula, your weight, and based on that you come to that conclusion how much is enough for you.
So, Seema,
From my own experience, I'll tell one thing. When I go to my village on hills during summertime, and I do some work, physical work, physical job. During that time, there is a lot of perspiration, and the season is also summer season. So at one time we take 1 liter of water at one time, but during winter season, not possible.
Yes,
during
yes.
winter during winter season we can take only one glass of water.
Yeah. So that is the problem here in Canada. During winters, people drink less water. They don't feel thirsty. The thing is, then they think, oh, we are hungry, we have to eat more. That is what is happening.
So, Seema ji, I read some people, some nutritionists, they say that count your green tea, coffee also as your water intake, but then others say that no, that's dehydrating, and if you drink coffee, tea, then you need to double your water intake. So what's your opinion on that one?
That is 100% correct, because see, with coffee and all, coffee is more like a diuretic, right? So what it does, it helps, it flushes more water out of your system. So to overcome that, you have to have more, like when you are having tea and coffee, you have to have more water when you're consuming all the caffeine based foods, because like it's like a diuretic for your system. So the thing is, then you will be in the state like you will be dehydrated. Happen. So it's always,
sorry, go ahead.
Especially with coffee, you become dehydrated. So it's better to have more water when you're consuming coffee. And with green tea, I'm not 100% sure, but anything that is more coffee based, right? It's always better.
Now, Dr. Sapan, the analogy you use for people walking in hills, and I from time to time I hire a personal trainer also. So he used the same thing. He told me that when you do intermittent fasting, when you cut down your calories, then our brain, our body is smarter than us. The next time you're going to eat, it will immediately convert it into fat, so that it wants to be, survival. It goes in survival mode, and it doesn't leave any carb. It immediately converts it into fat. So it's different people, different studies, they have different outcome. Won't the same use for intermittent fasting, in your opinion? What are your thoughts?
Now, I have a different take on that. I feel very positively towards intermittent fasting. And I've personally, at least anecdotal evidence, I've definitely felt benefits. And so I try to, even patients who have metabolic syndrome or hepatologists, For example, for patients who have fatty liver, they recommend you should not eat after 6 p.m., for example. And that's a form of intermittent fasting in itself. Presumably, you don't eat after 6 p.m. The next meal you'll probably have will be, 8 o'clock in the morning or so, breakfast, which is in effect 14-hour fast. So, my feeling is that no, in fact, when you're fasting, your body does convert into a different kind of state where you're burning the glycogen, you're using the storages, cleaning out, detoxifying your liver while you're fasting. That's my take. But of course, Ashish, with these things, a lot of the studies are based upon animal studies and mouse studies. I mean, we don't really know what's happening inside our body because who's going to open up, dissect a human being and check what's happening inside? It's virtually impossible. Almost all the literature out there is mouse studies. You read up on leptin, you read up on ghrelin, or any of these other adipose tissue hormones. These are all mouse studies. And so it may be, there might be some truth in what I'm saying. There might be truth in what your trainer is saying. As we say, the truth is never black or white. It's generally gray, somewhere in the middle. The truth probably lies somewhere in the middle. But as a personal experience, I've definitely found that whether you go for a high protein Atkins or a high fat keto, or whether you go for a high natural non-processed paleo diet, some element of intermittent fasting added in certainly will reap benefits in your weight loss journey, along with all the habitual changes we talked about. We talked about green tea, water, snacking, respecting your food, discipline, all of that. Seema, go ahead.
Yeah, I have a question. Okay, so normally when you are going for a blood test, right? So fasting, and after that they go for a blood test. What if you're going after 16 hours? It's not correct. Because is it because the glycogen stores are being used? See, the blood sugar in our body, when you wake up, you are 12-hour fasting, you do a blood test, you get some values. But what if that person goes after 16 hours? How is the blood test going to change? I just want to know that. Will it really make a difference?
For that question, I'll have to ask my good buddy, Dr. Kargeti, the endocrinologist, to come in and answer that question. That's very complex.
I always had this question from a long time.
My understanding is
12 hours of fasting, right?
Is actually more for, there are two things. One, it is more for triglycerides, because triglycerides are better measured with fasting levels than non-fasting. Secondly, when we are fasting, there are two advantages. One, if someone has a sugar, 3-month average sugar, which is the HbA1c, if the HbA1c is between 5.5 and 5.9, we call it at risk of sugar problems. But that is not affected by fasting because it's a 3-month average sugar. It's a 3-month average, not affected by fasting. However, some patients will have some degree of impaired glucose tolerance or impaired fasting glycemia. However, but their A1C is still normal. So these people are at the very early stage of becoming insulin resistant. Those patients may have a fasting sugar of above 5.6. So they may have a normal A1C but a normal fasting sugar of above 5.6. And so a fasting blood test gives us the benefit of being able to pick up on those very early patients who are developing insulin resistance. So that's the other advantage. One is triglycerides and the other one is picking up on impaired fasting glycemia.
Yeah, so I have read in some articles also that 24 hours of water fasting will reverse most of the conditions like high blood sugar and all. Is it true? 24 hours of water fasting. So if a person is really having a high H1, the score for that is high, and when that person fasts for 24 hours and again does a blood test, does it really have an impact on that fast? Just the water fast?
I would just describe it as another form of an extreme diet. So there's so many extreme diets out there. But all the scientific evidence really is for short term. They may have some short term benefit, but if you cannot maintain that long term, then it's not of very much value. So obviously, everything we discussed so far is something you can maintain long term. You can drink more green tea. You can have more healthy snacks like celery, carrots, and hummus. You can do some not eat late, eat earlier. You can respect your food and sit on a dining table. You can try to eat without getting distracted, not watching an iPad or your phone or TV while you're eating. These are long-term changes. But water fasting 24 hours, that's a very short-term thing, which may have some benefit, but it's likely to be short-term, not long-term. Ashish, you wanted to say something?
No, nothing. Thank you.
Great. So are we done because I think we're just entering into a 2-hour mark, so we've been talking for a long time. Today is my birthday as well, so I need to go out and celebrate my birthday as well today.
Happy
Thank you
birthday
so
once again,
much.
Sapan.
God bless
Happy
you.
birthday.
Thank you so
Again,
much.
happy birthday
Thank
to
you.
you. Happy birthday to your
Happy
brother
birthday. Yeah,
Praveen.
it's
Happy
14th
birthday,
there.
Sopan. Happy birthday, Praveen. May God
Happy
bless you
birthday.
both.
Thank you, Seema. Thank you, everyone. Thank you, parents. Yeah, and today is Valentine's Day for everyone else, so happy Valentine's Day to all of you as well. So
Yes, same
the
to
good
you.
and
Thank
Thank you
you.
so
Same
much,
to you and same
everyone.
to
God
everybody.
bless.
Here,
God bless all.
here in the morning, we were having our breakfast and watching your program also, Valentine, that music program. And it was so nice. We enjoyed it so much. And these people were not there. Ashish was not there. Uh, she was also not there. But most people enjoyed. There you have very good singers also. In fact, the first singer is really excellent.
Navneet, yes.
Navneet and one or two more. The rest were anyway. These things can be discussed later on.
Well,
Also,
But
Daddy,
it was
Ashish was playing very good.
that video is in 2 parts.
and Ashish,
Daddy,
Ashish is very good.
if you look,
Ashish
that
piano.
Yeah,
Yes.
It was different.
Yeah, we enjoyed it.
Dr.
Very,
Navneet
very
is a very he's a pediatric intensivist. So he looks after very sick premature babies, but he's also a renowned singer. He does shows, and if you look at his Facebook page, he's got over 15,000 followers. And last time he sang a song for just 1 minute. It was a Kumar Sanu song, Sochenge Tumhe Pyar. Within 3 days, he got 160,000 views on Facebook. In 3 days.
Yeah.
So
That's what I said.
Yeah, he's a next level singer, and we are very, very proud to have him as part of our
Very good
group.
singer.
And all the people, Papa, that you saw singing there, we are weekly. Every Saturday night we get together and sing. So that's our regular karaoke music group. You can see we've got my instruments in the background here.
Very good.
Great. Well, thank you so
Can
much.
I make one suggestion?
100, please.
I had one suggestion to make that
Mhm.
when you are arranging these get-togethers and singing, then it should be like that. One good singer, then of course the next no problem, and then third should be good like that. Phase out. Otherwise, if we put together all the good ones one side and all the bad ones one side, then nobody listens to it.
That's a nice one, Daddy. Thank you. We'll bear in mind. So I'm just going to end today with a monologue. So I'm going to just mute everyone, and I'm going to just do a bit of a monologue again. So today we talked about how to manage obesity, how to lose fat, and how to maintain an ideal weight. It cannot be emphasized how important this topic is, because the whole idea of health is to prevent premature mortality, to prevent premature death, and also to prevent premature morbidity, so disabilities. And what are the top 3 things that we are concerned about? Today we're concerned about COVID-19, coronavirus infection. We're concerned about heart disease and strokes. We're concerned about cancer. Obesity is something which affects all of these things. And so I would like to request, a lot of time and effort goes into creating these videos, into all the people who spend their time on this. This video has been going on for 2 hours now. If you can just share this video, it just takes one click of a button. It may help someone else. get onto their health journey, it will improve their health. Because the top 3 things that we are worried about, infections like COVID-19, cancers, heart disease, and strokes, obesity is implicated in all of these things. So this is a very important topic. It is central to maintaining a good health. So please share widely. Thank you very much, everyone. See you again next week.
Thank you so much. Thank you so much. God bless you. God bless everyone.
Thank you,
Thank you,
Seema ji.
everyone.
Thank you, Sapan.